What's up, guys? Welcome back to the nursing channel. I'm here with, this is Nurse Sam. I'm here with my boy,
Hey guys.
Nurse Wiljon. And right now we're going to talk to you guys about being a prison nurse. Wiljon is a nurse in prison. He's worked there for, how long has it been? How long have you worked as a prison nurse?
I worked there for a year. I don't know if you guys remember me, but if you looked at recent videos, I was a case manager at a home health center.
Yeah, exactly. So
right?
if you scroll through some of my videos in the nursing channel, you're gonna find Wiljon there. His first position as a nurse was in home health, and so that's a really good video that we made together. He provided some really good insight and knowledge if you guys are ever interested in going into home health nursing. But now Wiljon has transitioned into the prison setting, and he works as a nurse there. And so yeah. So Wiljon, what made you want to apply for a position at a prison?
Good story.
How did that start?
So I actually work for a registry. I'm not sure if any of you guys are familiar with the registry, but while I was doing home health, I was working on a wound. They called me and then later I called them back and they told me and they asked me, "Hey Wiljon, we have an opening to work in a prison.
Wow.
Do you want to work in a prison?" So I said yes. I didn't really apply.
Yeah.
So I just started working in the prison the next month.
Wow. So you didn't have any previous prison experience working?
No,
at a prison?
I just thought it would be cool, you know.
You just thought, and they just said like, "Hey, this position is available if you want to apply to it."
Yeah.
Awesome. Interesting.
Yeah.
What were your thoughts going into that job? Because I mean, that's a completely different setting from going from working at patients' homes to working in a prison. I mean, when I think of a prison, I mean there's inmates. I mean, people are in there for really bad things that they've done. You know what I mean? So I mean, it's a different culture. I mean,
it can change.
Yeah.
It can change you.
Yeah, so describe the setting for me.
The setting, normally, you know, you're a home health nurse to a prison. It's different. In home health, people are more friendly. They let you in. You can have a relationship with your patients, right?
Right.
But in the prison, you wouldn't really want a relationship with your patients. You wouldn't want that. So we kind of just treat them and then move on. That's kind of just the gist of it.
Yeah. I mean, describe some of the patients you work with, man. Are they like tatted up from the head down to the feet?
Yeah, they have a lot of prison tats. You can see it because they kind of just get these needles and they make their prison tattoos from anything. They're pretty big. They're pretty big people. But don't be afraid if you're thinking of going to the prison. It's really not as bad as you think because they're also really big officers. So.
Okay.
They'll help you out. They'll be there by your side.
Oh, very nice. So you're not like walking alone in the prison. You have
not usually.
You have some bodyguards next to you in case some of these prison inmates want to hurt you.
Yeah. But also be wary though. You can't just rely on them for sure. You always need to have good street smarts.
Right.
Be ready. Be ready. Don't be kicking distance from a patient, from an inmate unless you have to.
Okay. So how much distance do you have when you interact with like the prison inmates?
We're usually very close.
Very close. So like we're on that right now.
We're pretty close like this. But other than that, if you are close like this, be careful. Be ready to go. You know, stand back, to move back. Watch your body language, and mostly if you're not doing any patient interaction, try to be kicking distance away from the patient.
Okay. And how close are your bodyguards, like the prison guards, just to make sure?
They're usually by your side.
So they're like right here. You have two or one?
Usually one. Sometimes they're girls.
Oh really? Wow.
They're small little girls, but you know they have batons and pepper spray, so they'll still be able to help you.
Okay. Awesome. So sometimes you never know. You might have to fight for yourself.
So
because the female officer may not be able to help you out as much, right?
Yeah, but it's okay though. It's okay. They have pepper spray. Everyone has pepper spray. And another thing that helps is the prisoners are institutionalized. I'm not sure if you've heard that word.
So what does that mean? I don't know what that means.
It kind of means that they've been pounded into submission. So they already know the rules of the prison, and if they get out of those rules, they're not gonna like it. They're gonna go to ADSEC, and they're not gonna enjoy their time in prison. So most prisoners, they respect the nurses.
Yeah.
If they don't respect the nurses, they get backlash.
Oh wow! And I assume they would want to respect you because you're taking care of them.
Exactly.
You're giving them their pain medication,
Yeah.
and they need you. They need to keep you safe.
Hey, if anyone messes with you, the other prisoners are not gonna like it either.
Awesome.
Yeah, so it's good.
So everybody's watching your back. That you're in a
Everybody's
safe. For the most part, you're in a safe, controlled environment,
Yeah,
right?
but of course, still be careful.
Just be careful.
Still
Always,
be careful.
always keep your guard up, just no matter what.
Yeah.
Perfect. And what are some of your job duties at the prison?
There are, I think, two main job duties in the prison. You have TTA, which is triage treatment, which is almost like the emergency room of the prison. If there's anything crazy going on, that's usually what I did. You would have to be there within 8 minutes and then treat them. The person would have things as small as a cut from a fight, or even a heart attack. So you just need to be prepared. You need to bring an emergency bag with you to check them out. Be ready to give them an EKG. Be ready to treat them for a wound or anything. And the other one, aside from TTA, would be a clinic nurse. They usually work in the weekdays, in the daytime, and the patients come to them who need help, and they treat things like wounds and toothaches, those kind of things.
So very small, minimal stuff. It's not like major things like having to hang IV bags or
We actually don't have IVs in the prison.
or starting IVs, giving a blood transfusion, nothing like that.
Nothing
right?
like that.
Very small, minimal stuff.
Smaller. If anything is crazy, we bring them out to the hospital.
Okay, so you arrange for transportation to the hospital,
Yeah.
or
It's either transport. If it's not crazy critical, we transport them. But if it's really really bad, we call 911 and the ambulance comes.
come pick them up. Okay,
Yes.
perfect. So those are your main two duties.
Main two duties. I was usually the TTA nurse, and I work night shift.
Okay.
But
And-
there are other.
all right, perfect. And what are your hours working at the prison?
It's usually 8-hour shifts.
Okay. Is there opportunities for 12-hour shifts?
I haven't seen that
You
yet.
haven't seen that yet?
I haven't
Okay.
seen it. I worked in Sonora, in Jamestown Sierra Conservation
Yeah.
Center, and it was 8 hours.
Okay.
I don't
And-
think there are any other.
And working during the night shift, do you get a night differential? Do they pay you more for working nights?
You'd have to talk to your registry about that. I don't
Okay.
think
You
they
don't think so?
really did.
Okay.
I don't think they really did.
Yeah. And how's the pay working for a registry at a prison?
It was pretty good. I think.
Yeah.
I'm not sure when COVID started, people would be getting paid like the 90s. 90s.
So like around 90 something dollars an hour?
96 an hour.
$96 an hour. That's a lot of money, guys.
Yeah. Well, of course, I was in COVID time. Nowadays, as COVID dwindles down, it might be less. So check with your registry, talk with them. I got more around the 70s. You could get to the 60s. Who knows? Who
Yeah.
knows?
Okay, perfect. Awesome. So there you have it, guys. This is what it's like to be a prison nurse. If you guys have any questions or have any comments, put it in the comment section below. Do you want to share your Instagram, or where can people follow you? Or
I actually don't have an Instagram.
you don't have an Instagram? No worries, man.
Maybe
Well,
one day.
Yeah. Well, anyways, we're happy to have you back, man. Hopefully you can collaborate with us and make more videos.
Sure.
Yeah, guys, that's all we have for you today. Thank you for tuning in, and we'll see you in the next video. Peace out.
See you guys.